The World Health Organization Pandemic Treaty is marching right along, set to be put into law next May if nothing happens by global governments. This is the treaty we've been warning you about that would supersede global governments' ability to self govern whenever the WHO decides that there is not even an emergency, but a potential for emergency. It's probably the biggest power grab we've ever seen in modern times. It is binding. It will cost your country a lot of money. Some politicians are kind of speaking out I'm sorry. Some politicians are speaking out against it, but not very many. One organization is doing something. That's the Global Health Project. They launched a national campaign that urges President Biden and Congress to oppose this treaty. Joining us to discuss is Dr. Kat Lindley, the director of the Global Health Project. So thank you so much for joining us.
Thank you for having me today.
Now, can you tell me who is the Global Health Project and why are you doing this?
We are a coalition of different organizations, scientists, physicians, educators, advocates who came together last summer to start talking about what has happened and how do we make sure that this doesn't happen again. So we actually produced a video with physicians and speaking about their own journey to what happened during the pandemic, how they came to realize that the system was broken and things like that. For myself, I've always been, since I'm from Croatia, I was born in Croatia and, I live in the United States. I went to medical school here. So I always looked at this whole pandemic issue globally because I was always intrigued by the fact that every government was saying, build back better. The messaging came together. And then, we started following WHO recommendations and things like that. And as that was happening, WHO started putting together this pandemic treaty and the amendments to the IHR. And obviously, that became a grave concern.
Okay, so can you outline for me the dangers that you see in this pandemic treaty and, as you say, a grave concern?
So it's exactly like you said, what happened during the pandemic, WHO did come up with some recommendations. The countries' regulatory agencies followed them as they chose to do so. But with the pandemic treaty and amendments to the IHR, as you said, this will not be recommendations anymore. They're going to be obligations, and we're going to have to comply to them. Um, the amendments to the IHR is international health regulation that we've adopted into our international law. Some of those amendments, particularly Article 12, will give Director General powers to to actually call something, health emergency of international concerns, whether it fits criteria or not. And if that happens, then the Director General or his regional directors would actually have powers to dictate how any country would comply, whether that's with quarantine, travel restrictions, medication, treatments, potential new vaccines, and things like that. From our standpoint, if you look at this, that means that this international body that has nothing to do with our own country would actually have sovereignty over our health policies. And as far as I'm concerned, that actually would have implications on national sovereignty as well.
So one of the things that bothers me the most about it is not just the fact that they would dictate what vaccines must be taken, what lockdowns must be had, what surveillance must be done, what mask mandates may or may not be put in place, what vaccines must be taken, but also this sort of existential threat of climate that may then
Yes.
cause future pandemics means that they can redistribute resources. So if they say, well, the meat industry is really hurting the planet and we could get more zoonotic viral diseases, then nobody can eat meat anymore because we say this. I mean, I don't think that's too much of a stretch. The redistribution of resources around possible emergencies is the thing that keeps me up at night. Do you want to speak to that at all?
No, I agree. And that goes under the One Health agenda within the treaty itself. What people are not aware, most of our countries have actually already started implementing this One Health, and there is, departments within HHS that actually deal with that. In One Health, what they say is that the life of humans, animals, plants are equal to each other. And again, yes, they can be influenced by climate change and other things. So all of these things can interact, and we will have to worry about They were trying to indicate over the summer that climate change is our new pandemic, and United Nations actually speaks about that a lot. And you're exactly right. They can decide not only the foods and things like that, but also water. There's been recently a lot of talks coming from WEF and United Nations that we have to be concerned about the water and other natural resources.
Yes, that's also terrifying. Now, the media and covering this pandemic treaty, if they do it all, which they don't very often, they publish headlines like, oh, it's not binding. Oh, it's not really going to take away government sovereignty. Those are myth busted, they say, without really proving it. They're just saying that that's what they think, as if they haven't read it. We have read it. And we've shown them these bits on the show where the word binding is crossed out, or these, human rights are crossed out. So why do you think the media wants to sell this as harmless?
One of my favorite things is when the media says it's not a treaty. And the reason they say that is because WHO has realized that people around the world have started several petitions. They don't want it. So they changed the name from treaty to agreement to CA++, and recently accord or accord agreement. I forget which one comes first. I think the reason media is doing this is because that's what they've done for the past 2-3 years. I don't want to be cynical, but I would
Well,
just
you
say
can be a little
that
cynical, and if we admit to being cynical, then at least we can extrapolate a little bit. It's okay.
well, I'm not sure who their master is anymore. I would say their
Right.
masters are definitely, these private-public partnerships that we see with WHO. We definitely see that they have lost the integrity. I know you're a journalist and this is your passion and your love, but I do remember in the 90s, I loved watching journalists just tell the story, put the facts out there, and allow the viewer to actually come up with a conclusion. We don't have any of that anymore. And I think that's one of the, everyone says physicians have lost their trust, and we have. We have done a poor job this pandemic. But I would say same thing for journalists. They've lost all of our trust because they're making conclusions for us. And then if you dare to disagree, they call you a name, they put a label, misinformation, disinformation, and all that. So I would say their master is definitely not the people, and that's why they're trying to sell it to us.
Yeah. One of the things that I have wondered is that if they admit that this is a scary prospect and that it may put into place mandatory mask mandates or mandatory vaccines, or mandatory lockdowns, then they would have to admit that those things caused harm during the pandemic. And the media has not been wanting to do that. Even they just can't eat that slice of humble pie, I suppose. That's my cynical take on it. What do you think?
It's hard to admit when you did something wrong, but it's human to admit that you did something wrong. So I hope that some of them find their humanity back.
Right. Now, and speaking of doing something wrong, the WHO had terrible performance during the pandemic. They provided no science, no guidelines. They played politics. Uh, they rolled out a vaccine that they did not admit the truth about. So, why do you think governments would defer to this organization that, in my opinion, didn't even meet D level work, if we're talking about it on academic terms? What is the rationale of that?
I think it goes back to these public-private partnerships. I don't know if you recently read some of the stories that we've written in Brownstone Epoch Times, but FDA actually has I forget what they call it, but it's like an memorandum of understanding with Bill and Melinda Gates Foundation. Why would our FDA have a memorandum of understanding with Bill and Melinda Gates Foundation? And then you take Bill and Melinda Gates Foundation, who are probably one of the biggest funders of WHO, and you see all of these connections that they have within the governments, within these organizations, and there's a lot of collaboration. I think there is obviously a lot of potential earnings and things like that they're all looking forward to. And as people resign from government, they become heads of Pfizer or go on their boards and things like that. There's so much intermingling in these organization and our governments that no one is really looking too deep into. One of the interesting thing, actually, WHO did really good in India, in the Uttar Pradesh region, where they allowed the ivermectin to be used for the COVID-19, but everyone kind of forgot about that and followed them on all the other flawed recommendations they had. As far as I'm concerned, the most important thing for everyone to realize is WHO should not be in charge of our health. If there is another pandemic that comes again, you would want to have a physician who actually has a relationship with you and you can decide if you can be treated or not. You don't want someone who says, well, you're not allowed to use this medication. You only can use this other medication like we've seen during this pandemic.
Now, I regularly find false information on Google Bard. That's Google's AI program. So when I looked into who's funding the Global Health Project, your initiative, Google Bard tells me that you have donations from Bill and Melinda Gates and also the World Health Organization. It could not prove where it had found those. When I asked, can you link me to where that information is? It said it cannot. So can you respond to that? Because why would you be working against the WHO and asking Congress to not give them this power if the GHP was accepting donations from them and also Bill and Melinda Gates?
So after we finish this, I'm going to do the same search to see exactly what they're saying because
I'll send you a screenshot.
Funny.
Yeah.
That's awesome. No, obviously, we are completely funded by people. We have asked for donations on our website. You can donate as well. We have not received any big fundings like that. And we had a recent project for Maui concert where we raised, I think we raised about $30-some thousand, and that was directly from donations from the people. So that couldn't be further from the truth.
Okay. I figured as much.
We could do so much more if that was true, but it's definitely not true.
Okay. All right. So what you're doing with this initiative is trying to tell people this is something scary. Get involved, educate yourself about it, and tell your representatives, right? So what else can they do?
The most important thing is to actually call the representative office and say, are you aware that there is a pandemic treaty that the World Health Assembly is going to meet in May of next year and they're going to vote on pandemic treaty, but also are you aware of the amendments to the international health regulation? Because most of those are being pushed by our own Health and Human Services. You actually need to look at these two documents together because they empower each other. Ultimately, what we need to do is withdraw from WHO. There is no reason for WHO to be receiving funding from the United States and for us to collaborate with them and then have them tell us how we can plan for future pandemics if they come, or emergencies or whatever they are. None of them should have, WHO should not have power over that. Only patient physicians should be in charge of their own health. It's very important that everyone reaches out to their congresswomen, congressmen, and the senators.
There was a bill in Congress to prevent the president from signing this. I can't remember the sponsor off the top of my head, but it hasn't gone very far as I can tell. Is that correct?
There are several bills in the House. One of them is by Chip Roy. Andy Biggs, I believe, had one as well. And then Senator Johnson had one in Senate. They haven't gone far, but there is a renewed interest because I think Americans are becoming more concerned where is their money going to, especially with the trillions of dollars that we owe. So, having a new speaker in the House who is fiscally responsible, I think there's going to be a little bit more traction. So it's really important to reach out to them.
Okay, great. So where can we find out more about your initiative? I do suggest everyone watch the 9-minute video that is summarizing this. It's at Global Health Project. So on X, it's at Global H Project. And then anywhere else we should look?
Yes, so you can, like you say, you can find us on Twitter, and our website is globalhealthproject.org. But more importantly, these documents are available online. It's very important to follow different organizations who are speaking out about this. Sovereigntycoalition.org is another organization who is speaking about this and has several Align Acts that you can sign that will go directly to your representatives and ask them to look into this. Ultimately, what we need to ask is to exit WHO, most likely United Nations as well, but that's for another day.
Okay, I'm with you on both. I would love for nothing better than for our government to not be a part of those organizations. So thank you so much for speaking out about this and this initiative, and we will follow. And everyone who has an elected representative in whatever, especially Western countries, I think are the ones who are most gung ho about this. But Eastern countries too, reach out and tell your government no on this. Thank you again for your time.
Thank you.
Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern Time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.